Question 1. A nurse is gathering pertinent health history from a patient. The patient mentions taking atomoxetine. The nurse understands that this medication is used to treat which of the following? A. ADHD. B. Anxiety. C. Bipolar disorder. D. Schizophrenia. Correct answer. A. ADHD. Atomoxetine is a non-stimulant medication used to treat attention deficit hyperactivity disorder by increasing norepinephrine levels in the brain, which helps improve focus and attention. Question 2. A patient is admitted to the hospital for a lorazepam overdose. The physician to order the administration of which of the following? A. Flumazenil. B. Methadone. C. Naloxone. D. Naltrexone. Correct answer. A. Flumazenil. Flumazenil is a benzodiazepine antagonist specifically used to reverse the sedative effects of a benzodiazepine overdose, such as lorazepam. It works by blocking the action of benzodiazepines on their receptor sites, thereby counteracting symptoms like sedation and respiratory depression. Question 3. A nurse is gathering health history information from a patient. The patient mentions taking duloxetine, but isn't sure of its purpose. The nurse should explain that this medication is used to treat which of the following? A. Alzheimer's disease. B. Depression. Post-traumatic stress disorder. D. Schizophrenia. Correct answer. B. Depression. Duloxetine is a serotonin norepinephrine reuptake inhibitor primarily used to treat depression by increasing serotonin and norepinephrine levels in the brain. Question 4. A patient has been using doxepin for 6 months. Which of the following statements suggests the patient requires additional education? A. I should avoid pregnancy while taking this medication. B. I will avoid over-the-counter medications. I will stop taking this medication immediately if I feel dizzy. I will report any chest pain. I will report any. Correct answer. C. I will stop taking this medication immediately if I feel dizzy. Stopping doxepin abruptly can lead to withdrawal symptoms and worsen the condition. The patient should consult their healthcare provider if dizziness occurs, not discontinue the medication without guidance. Abrupt withdrawal can cause flu-like symptoms, dizziness, fatigue, and insomnia. Question 5. What is the most effective method for preventing skin breakdown? A. Assistive devices. B. Repositioning. C. Avoiding tape and band-aids. D. Topical medications. Correct answer. B. Repositioning. The most effective way to prevent skin breakdown is repositioning because it helps alleviate prolonged pressure on specific areas of the body, particularly in immobile or bedridden patients. Continuous pressure reduces blood flow to the skin and underlying tissues, which can lead to pressure ulcers or sores. By repositioning every 2 hours or as per protocol, blood circulation is improved, oxygen is delivered to tissues, and pressure points are relieved. This practice is crucial in preventing the development of pressure injuries, especially in high-risk areas such as the sacrum, hips, heels, and elbows. Repositioning, combined with proper skin care, hydration, and nutrition, significantly reduces the risk of skin breakdown. Question 6. A patient is admitted to the hospital for an overdose of oxycodone. The physician to order the administration of which of the following? A. Flumazenil. B. Methadone. C. Naloxone. D. Naltrexone. Correct answer. C. Naloxone. Naloxone is a competitive opioid receptor antagonist used to treat opioid overdoses. Naltrexone is a non-competitive opioid receptor antagonist, primarily used for opioid dependence. Flumazenil is a GABA antagonist used to manage benzodiazepine overdoses. Methadone is an opioid analgesic commonly prescribed for opioid dependency. Question 7. Which of the following should be carefully monitored in a child with attention deficit hyperactivity disorder who is taking Ritalin? A. Dental health. B. Excessive appetite. C. Height and weight. D. Mouth dryness. Correct answer. C. Height and weight. Stimulant medications like Ritalin, methylphenidate, can decrease appetite, potentially leading to weight loss and slowed growth in children, so it's important to regularly monitor height and weight. Question 8. A patient is prescribed levodopa-L-dopa for the treatment of Parkinson's disease. Which of the following side effects should the nurse specifically monitor for during treatment? A. Diarrhea. B. Excessive secretions. C. Hypertension. D. Psychosis. Correct answer. D. Psychosis. Levodopa, L-dopa, is a dopaminergic drug that boosts dopamine levels in the brain, helping to alleviate symptoms of Parkinson's disease, though it may also lead to psychosis. On the other hand, antipsychotics reduce dopamine levels, which can sometimes trigger Parkinson-like symptoms. Common side effects of dopaminergic medications include psychosis, nausea, dizziness, postural hypotension, constipation, and dry mouth. Question 9. A 45-year-old woman with newly diagnosed metastatic breast cancer is prescribed tamoxifen 20 mg orally twice daily. During initial patient education, which side effect should the nurse prioritize discussing with the patient? A. Menstrual irregularities. B. Vision changes. C. Deep vein thrombosis. D. Hot flashes. Correct answer. C. Deep vein thrombosis. Tamoxifen is an anti-cancer medication that blocks estrogen from binding to its receptors. More than 60% of patients taking tamoxifen experience hot flashes. Other side effects include vaginal bleeding, amenorrhea, absence of menstruation, menstrual irregularities, nausea, vomiting, rash, itching, pruritus, osteoporosis, bone pain, and an increased risk of fractures. Question 10. An 8-year-old hospitalized patient is receiving subcutaneous heparin. Which of the following is a potential side effect of heparin? A. Diarrhea. B. Leukopenia. C. Thrombocytopenia. D. Tinnitus. Correct answer. C. Thrombocytopenia. Heparin is an anticoagulant medication that prevents the conversion of prothrombin into thrombin. It can lead to a reduction in platelet count, a condition called thrombocytopenia, which increases the risk of bleeding. Question 11. A patient with a history of a severe hypersensitivity reaction to penicillin is admitted to the hospital. Which of the following classes of antibiotics should the patient avoid in the future? A. Cephalosporins. B. Fluoroquinolones. C. Macrolides. D. Tetracyclines. Correct answer. A. Cephalosporins. A patient who has experienced an anaphylactic reaction to penicillin is also at risk for a similar reaction to cephalosporins and carbapenems. Penicillins, cephalosporins, and carbapenems all contain a beta-lactam ring in their structure, which can trigger allergic or even anaphylactic reactions. Question 12. A patient with hypertension and asthma is prescribed propranolol, Inderal, a non-selective beta blocker. Which of the following side effects is the patient most at risk for? A. Alopecia. B. Bronchospasm. C. Hypoglycemia. D. Insomnia. Correct answer. B. Bronchospasm. Propranolol is a non-selective beta blocker, meaning it blocks both beta-1 and beta-2 adrenergic receptors. Beta-2 receptors are found in the lungs, and blocking these receptors can cause bronchoconstriction, which may lead to bronchospasm. This can be particularly problematic for patients with asthma or other respiratory conditions because it can worsen breathing difficulties or trigger an asthma attack. Question 13. The LPN is caring for a patient with ascites related to liver failure. The patient experiences hypotension and cramps. Which of the following is least likely to be related to these symptoms? A. Decreased renal blood flow. Excessive IV intake. Increased aldosterone. Recent diuretics. Correct answer. B. Excessive IV intake. In liver failure with ascites, excessive IV intake could exacerbate fluid retention, but wouldn't directly cause hypotension and cramps. Hypotension and cramps are more commonly linked to decreased renal blood flow, increased aldosterone, or electrolyte imbalances from diuretics. Question 14. A patient with coronary artery disease and high cholesterol is hospitalized and prescribed simvastatin to control her cholesterol levels. The nurse should inquire about which of the following potential side effects. A. Blurred vision. Confusion. Flushing of the head and neck. D. Myalgia. Correct answer. D. Myalgia. Simvastatin is a statin medication used to lower cholesterol levels by inhibiting HMG-CoA reductase, an enzyme involved in cholesterol production. A common side effect of statins, including simvastatin, is myalgia, muscle pain, or weakness. In some cases, this can progress to more severe conditions like rhabdomyolysis, which is muscle breakdown that can lead to kidney damage. Question 15. A patient experiencing severe respiratory distress is prescribed continuous albuterol nebulizers. Which side effect should the nurse anticipate? A. Bradycardia. B. Excessive salivation. Hyperkalemia. Tremors. Correct answer. D. Tremors. Albuterol's side effects stem from its stimulation of the sympathetic nervous system and may include tachycardia, palpitations, tremors, dizziness, anxiety, headache, and dry mouth. In high doses, it can also lead to hypokalemia. Question 16. A patient prescribed clopidogrel, 75 mg, to be taken daily for the prevention of a myocardial infarction, asks the nurse why this medication is necessary. What type of medication does the nurse explain clopidogrel is? A. ACE inhibitor. B. Antiplatelet medication. C. Diuretic. D. Statin. Correct answer. B. Antiplatelet medication. Clopidogrel is an antiplatelet medication. It works by preventing platelets in the blood from sticking together and forming clots. This is particularly important for patients at risk of myocardial infarction, heart attack, as clots can block blood flow to the heart. By inhibiting platelet aggregation, clopidogrel helps reduce the risk of clot formation and subsequent heart attack. Question 17. Which common side effect should the nurse instruct a patient diagnosed with epilepsy about when prescribed valproic acid? A. Encephalopathy. B. Hallucinations. Hyperammonemia. D. Tremors. Correct answer. Hyperammonemia. Valproic acid is a medication commonly used to treat epilepsy, as well as other conditions like bipolar disorder and migraine prevention. One important side effect of valproic acid is hyperammonemia, which is an elevated level of ammonia in the blood. This can lead to serious complications, including confusion, lethargy, and, in severe cases, encephalopathy, brain dysfunction. Patients taking valproic acid should be monitored for signs of hyperammonemia, and if detected, the drug may need to be adjusted or discontinued. Question 18. A patient prescribed carbamazepine asks the nurse about its use. The nurse explains that the medication may be used to treat which of the following conditions? A. Alzheimer's disease. B. Chronic pain. Epilepsy. D. Parkinson's disease. Correct answer. Epilepsy. Carbamazepine is primarily used to treat epilepsy, also known as seizure disorders. It works by stabilizing the electrical activity in the brain and is particularly effective for certain types of seizures, including partial seizures and tonic-clonic seizures. Question 19. A patient has been taking lamotrigine for 2 years. Which of the following would indicate that the patient is experiencing the intended effects of the medication? A. Lower hemoglobin. A1C/B. Lowered blood pressure. C. Reduced tremors. Seizure-free. Correct answer. D. Seizure-free. Lamotrigine is an anticonvulsant medication primarily used to treat epilepsy, particularly in managing seizures. The intended effect of lamotrigine is to reduce or eliminate seizures, especially in patients with conditions like focal seizures, generalized tonic-clonic seizures, and certain types of epilepsy. Therefore, the best indicator of the intended effect of lamotrigine would be the patient being seizure-free. Question 20. Which medication should the nurse anticipate the physician will order for a patient at risk of developing a peptic ulcer following a traumatic accident? A. Loperamide. B. Ondansetron. C. Pantoprazole. D. Sucralfate. Correct answer, C. Pantoprazole. After a traumatic accident, the body is under significant stress, which increases the risk of stress-related ulcers or peptic ulcers, particularly in critically ill patients. The most effective way to prevent or manage these ulcers is by reducing stomach acid production. Pantoprazole is a proton pump inhibitor, PPI, that works by inhibiting the proton pumps in the stomach, which reduces acid secretion. This helps to prevent ulcer formation and promotes healing of the stomach lining. Question 21. In educating a client who has recently been diagnosed with gastroesophageal reflux disease, which of the following non-pharmacological interventions should the nurse emphasize? A. Eat dark chocolate. B. Elevate the head of the bed. Increase caffeine intake. D. Smoking cessation. Correct answer, B. Elevate the head of the bed. Gastroesophageal reflux disease, GERD, occurs when stomach acid flows backward into the esophagus, causing symptoms such as heartburn, regurgitation, and discomfort. Certain lifestyle changes can help manage GERD and reduce symptoms. One effective non-pharmacological intervention is to elevate the head of the bed. This position helps prevent stomach acid from traveling back into the esophagus, especially during sleep, as gravity helps keep acid down in the stomach. Raising the head of the bed by 6 to 8 inches, using a wedge or blocks under the bedposts, can significantly reduce nocturnal reflux and improve symptoms. Question 22. What is the most important assessment for the nurse to perform on a patient taking oral contraceptives during her annual pelvic exam and medication refill? A. BUN and creatinine. B. Blood glucose. C. Blood pressure. D. Oxygen saturation. Correct answer, C. Blood pressure. Oral contraceptives, particularly those containing estrogen, can increase blood pressure due to fluid retention and vasoconstriction. Therefore, monitoring blood pressure is crucial during checkups and medication refills, as elevated blood pressure may necessitate adjusting or discontinuing the contraceptive to reduce cardiovascular risks. Question 23. A patient is administered an intramuscular injection of depot medroxyprogesterone acetate. Which common side effect should the nurse inform the patient about? A. Dizziness. B. Increased bone density. Weight loss. D. Weight gain. Correct answer, D. Weight gain. Depot medroxyprogesterone acetate, DMPA, is a long-acting form of birth control, often administered as an intramuscular injection. A common side effect of DMPA is weight gain. This occurs in some women due to changes in appetite and metabolism, as well as possible fluid retention. Question 24. The nurse is caring for a patient who is taking tamoxifen for breast cancer prevention. Which of the following signs would indicate that the patient is experiencing a side effect of tamoxifen? A. Arrhythmias. B. Confusion. C. Constipation. D. Flushing. Correct answer, D. Flushing. Tamoxifen is a medication used for the prevention and treatment of breast cancer. It works by blocking estrogen receptors in the body, and because of this action, it can cause side effects commonly seen during menopause, as estrogen plays a key role in regulating body temperature. Flushing, hot flashes, is a very common side effect of tamoxifen, similar to the hot flashes women experience during menopause due to decreased estrogen levels. Question 25. Which of the following is considered a potential side effect of subcutaneous heparin in an 8-year-old hospitalized patient? A. Diarrhea. B. Leukopenia. C. Thrombocytopenia. D. Tinnitus. Correct answer. Thrombocytopenia. Subcutaneous heparin is used to prevent and treat blood clots, but a significant side effect, especially in pediatric patients, is thrombocytopenia, low platelet count. Heparin-induced thrombocytopenia occurs when the immune system reacts to heparin, leading to platelet activation and a risk of bleeding, making it crucial to monitor platelet levels during treatment. Question 26. Which of the following lab results is unexpected in a patient with Addison's disease? A. Hyperkalemia. B. Hypokalemia. C. Hypocalcemia. D. Hyponatremia. Correct answer. B. Hypokalemia. In Addison's disease, due to the deficiency of aldosterone, the body loses sodium and retains potassium, leading to hyperkalemia, elevated potassium levels, and hyponatremia, low sodium levels. Hypocalcemia, low calcium, may be seen in some cases, but hypokalemia, low potassium, is not typical in Addison's disease. Therefore, hypokalemia is the unexpected lab result. Question 27. While assisting the physician with a lumbar puncture on a patient suspected of having meningitis, the nurse observes the patient displaying symptoms such as cold, clammy skin, rapid breathing, and an elevated pulse rate. The nurse should A. Administer an analgesic. B. Encourage the patient to take deep breaths. Continue monitoring the patient. Alert the physician. Correct answer. D. Alert the physician. The symptoms of cold, clammy skin, rapid breathing, and an elevated pulse rate could indicate signs of shock or hypovolemic instability, which is a medical emergency. While the nurse continues to monitor the patient, these symptoms require immediate attention from the physician for proper assessment and management. Administering analgesics or encouraging deep breaths may not address the underlying concern, and therefore alerting the physician is the priority action. Question 28. What is the most appropriate response when a client with an NG tube asks if they can lie down after receiving evening medications through the NG tube? A. Yes, feel free to lie down. B. You can lie down in 5 minutes if your NG residual is below 50 Ls. C. You can lie down in 1 hour. D. You can lie down in about 30 minutes. Correct answer. D. You can lie down in about 30 minutes. This advice is based on the need to prevent aspiration after administering medications through an NG tube. Keeping the head of the bed elevated at a 30-45 degree angle for at least 30 minutes after administration ensures that the medications and any residual fluid move down into the stomach properly, reducing the risk of reflux or aspiration into the lungs. Lying down too soon after administration could increase the risk of complications, making it important to wait before allowing the client to lie flat. Question 29. A patient receiving haloperidol for acute psychosis is experiencing extrapyramidal side effects. To counter these side effects, the physician to order which of the following medications? A. Donepezil. B. Quetiapine. C. Trihexyphenidyl. D. Ziprasidone. Correct answer. C. Trihexyphenidyl. Haloperidol is a typical antipsychotic that can cause extrapyramidal side effects, EPS, which include symptoms like tremors, rigidity, and akathisia, restlessness. Trihexyphenidyl is an anticholinergic medication that is commonly prescribed to counteract these side effects. It works by reducing the overactivity of acetylcholine, which is thought to contribute to the movement disturbances seen in EPS. Question 30. Which food on the tray would be the best to start with when assisting a client with dysphagia at lunch? A. Toast. B. Jell-O. C. Apple juice with a liquid thickener. D. Diced fruit. Correct answer. B. Jell-O. Jell-O is the best option for a client with dysphagia because it is soft, smooth, and requires minimal effort to swallow, making it less likely to cause choking or aspiration. It's also easy to control the consistency to match the client's swallowing abilities.